Good morning, sir.
Good morning.
So today I'm going to present a case which I have seen in the clinic. She is 67-year-old postmenopausal woman for past 17 years and mother of 4 children, which were uncomplicated normal vaginal delivery. She is a housewife from Jaffna, presented with lumped vulva for past 6 months duration. 2 years ago, she was apparently well and started to notice involuntary passage of small amount of urine during coughing and sneezing, but no urinary leakage while resting and sleeping. She also noticed increased frequency of urine and urge to pass urine once in 2 hours daytime and 6 to 7 times in night. She never had bedwetting. She wants to go to the urine before toilet and has a habit of toilet mapping. She also has urge to pass urine, and while seeing the flow of urine and while opening the water tap, she wants to pass urine. She avoids going out due to this illness and it affects her day-to-day activity and quality of life. She also has avoiding urinary symptoms such as difficulty in initiation of the maturation. She needs to strain and intermittent flow, terminal dribbling and incomplete urination was there. She never had hematuria or acute urinary retention. She also has difficulties in opening her bowel tube. She never had involuntary passage of stools. These symptoms were progressively worsening over the time. During this 2 years duration, she has episodes of dysuria, suprapubic pain, and needing hospitalization for UTI. 6 months ago, she noticed a painless swelling in the vaginal wall, which is reducible initially and irreducible over time. She did not experience heaviness or dragging sensation at vulva, but except a mild discomfort. She is a manual worker and she is a non-patient with diabetes for the past 18 years and recently diagnosed with diabetic retinopathy and neuropathy features. She was on regular clinic follow-up and also she is a non-patient with hypertension, hypothyroidism, bronchial asthma for the past 13 years, which were under well control with the inhaler therapy, and her last exacerbation was 5 years ago. She is a mother of 4, which were uncomplicated normal vaginal delivery, and the largest birth weight of the baby is 4.5 kilogram. She doesn't underwent any past gynecological surgeries, and she doesn't have any non-allergies to foot, drug or plaster. She also underwent an open cholecystectomy under general anesthesia. She has a family history of type 2 diabetes mellitus and she is currently living with her children and grandchildren and she has adequate family support. In summary, 67-year-old postmenopausal woman, mother of 4 children and non-patient with diabetes, hypertension, hypothyroidism and bronchial asthma, presented with the urinary symptoms, mainly overactive bladder symptoms and lumped vulva for the past 2 years. On examination, her BMI is 31 and she is generally not pale and she doesn't have any neck swelling. Her pulse rate is 72 beats per minute, no ankle edema. Her CVS and RS examinations were normal today, sir.
So what about the gynecological examination?
On the abdomen examination, sir, there is no palpable masses, and on the vagina examination, there is a second-degree uterovaginal prolapse with rectocele and cystocele.
Have you demonstrated any incontinence?
There was no demonstrable urinary incontinence, sir.
So what are the problems you identified in this patient?
Uterovaginal prolapse, mainly second degree with rectocele and cystocele. Mixed urinary incontinence, predominantly an overactive bladder symptoms, sir. And her comorbidities too.
Medical
comorbidity.
Okay. So how will you manage this patient?
First, I have to assess the symptoms of the patient. She is mainly having the overactive bladder symptoms. So I would like to manage it with the urodynamic studies and the urine diary. And also, I have to manage her medical comorbidities too, sir. But she is having an obvious second-degree uterovaginal prolapse. I also have to consider the surgical management. But it may sometimes worsen her overactive bladder symptoms.
Good.
Then I have to manage medically for her comorbidities too. In the surgery-wise, I would like to do vaginal hysterectomy and repair for her. Before that, I would like to assess the fitness for her surgery with the echocardiogram and ECG. and basic blood investigations.
All right. So you want to assess the patient first and then manage accordingly. Yeah, as she's having overactive bladder with some prolapse, sometimes the surgery may worsen the conditions. So you had to do a urinary diary assessment, if possible, urodynamic assessment, and then consider pessary. If it is improving the symptoms, we can go for the surgery. All right. So she is a woman with all the mixed incontinence and urine prolapse. Bye bye. Thank you very much.
Thank you.